Hi, my name is Brian Wells. I'm an orthopedic surgeon at Steindler Clinic with a practice focus on hand, wrist, and elbow. I did my residency training at the University of Wisconsin in Madison, Wisconsin, and then did a one-year hand fellowship at the University of Florida in Gainesville, Florida. I'm here today to talk to you about trigger finger, also known as flexor tenosynovitis. Typically that's where you'll develop a catching or locking of the fingers. You try to straighten it out, the finger will tend to stick and not want to come out, and you may feel it kind of pop or lock down as you're bringing it in. Most often it just shows up all by itself, not really related to anything that you did or didn't do. It can involve any of the fingers, including the thumb. Sometimes it will kind of come and go on its own for a while. It can eventually progress to the point where the finger actually locks or sticks down and you need to use your other hand to bring it up and move it up. Typically you'll feel a clicking in this proximal interphalangeal joint or PIP joint here, although the issue is back here, and typically people will have some pain or discomfort with pressure or gripping here over the palm. And what's going on with trigger finger, I'll show you on the model here. This first layer is the palmar fascia, so we'll move that out of the way. And then focusing on the ring finger here, this actually shows both what's called the A1 and then separated by the black line there, the A2 pulley. And the trigger finger is typically related to a mismatch between the size of the pulley or tunnel that the tendons run through. And so the tendons are these gray structures running here all the way out to the tip of the finger. And if the tendon gets a little too big for the pulley or the pulley a little too small for the tendon, then you get that clicking or catching of the finger. And so some treatments we can try for that. Sometimes people will want to try splinting or keeping the finger straight in extension at night. That will occasionally work, although I haven't had great success with that. Other options for it are a steroid injection into the palm that we can do here at the clinic visit, which typically works about 80% of the time, give or take. And then the last resort is a outpatient surgery for it that takes about 15-20 minutes. It can be done under local anesthetic, so you don't have to go to sleep with anesthesia or have anything making you feel nauseous or sleepy or tired the rest of the day. Basically very much like going to the dentist. We just make the area numb, a little 1 centimeter incision over the A1 pulley, which again is right here. And then we just open that pulley up. It's almost like unbuttoning your shirt sleeve so that things open up. So at first you're kind of banging your fist through and then unbuttoning it or opening the pulley up. Tendon slides through, no problem. The surgery itself takes again about 15 minutes. A little soft dressing, you're able to use the hand right away, although it's a little stiff and sore for a couple of days. And then I typically see people back in about a week and a half to 2 weeks to get stitches out and make sure things are going well.